so are we ready?
Yep, we are.
Alrighty, so I chose the topic of AI and IVF and potential current and future frontiers of wombs. So I have a few main facets to go over today. So the first thing is an introduction to the world of art, which is equivalent to assisted reproductive techniques. And number two being AI in the implications of IVF, and there's a couple factors that I'm going to be discussing, so I'll just talk about that later. And for number three, the artificial womb, present and future, with a sprinkle of ethics. I had to put that in. So the field of assisted reproductive techniques. So it's a fairly new field, with the first IVF conception and birth being at 1978 in England. So it took a little bit longer for it to come into Canada. And so in between kind of the first IVF birth and the regulation is about where it came into Canada in terms of like genetics and embryology specialization. And in specific, on 1993, we had our first Royal Commission report, which was basically just in regards to recommendations towards, ethics, accountability, oversight, regulation of the field. And in 2004 was actually our first bill that got passed in terms of reproductive research. So it did take a little bit longer than the first conception to actually have legalization. So some common misconceptions. So the first thing is how effective actually is IVF. So when we kind of think about IVF as a technique in general, in our mind it kind of seems touted as something that's like a cure to infertility. But in reality, the statistical, analysis of it is much less so a cure, and it's more towards being an aid in, populations where people cannot conceive. And the specific definition would be, I'm pretty sure, a year of unsuccessful natural conception. And so the implications towards, how would I say this, like barriers towards natural fertility are still kind of present in IVF. It's not a sort of like miracle work kind of thing. So the actual efficacy of IVF for example, women 40 to 42 is half less so than women younger than that, after 6 cycles of IVF. So we still have these biological limitations. This is what I was trying to say. And then for number 2, biological egg retrieval. So it's not exactly a kind of natural process. It is, a very biologically extensive process where we do hormonal injections and a bunch of, procedures that could be kind of difficult for the female to handle. And so sometimes people have an issue with doing multiple cycles of IVF, things like that. So it's not just kind of this biological waiting for eggs to ovulate naturally. Number 3, IVF. Is it just something that you can do if you can't conceive? So usually multiple other forms of assisted reproductive techniques are done first that are less invasive, don't necessarily require egg retrieval, and then IVF is kind of the last resort. Number 4, healthy egg equals successful pregnancy. So the idea that having what I'm going to discuss as a highly graded egg is equivalent to a successful pregnancy isn't exactly accurate, because there are other factors involved, such as placentation, which is the main kind of culprit of miscarriage and even just pregnancy and fertility in general. And there was one other thing that I was going to say and I kind of forgot, so we'll just move on. So now we're going to discuss AI and IVF. So the first and probably one of the most important facets of IVF as a field is that there's a severe lack of standardization and objectivity in how we grade eggs. So each specialist or embryologist kind of has their own specific grading that they use. It's not like a standardized format between the industry, up to basically a scale discrepancy where some clinics might say grade 4 is equivalent to the highest, some might say grade 1 is equivalent, so it's quite frankly like very different in between clinics. And the other point is that when we're looking at specifically embryo morphology in order to grade eggs, that is done by eye through microscope. So again, there's lots of human error and objectivity involved there as per, the varied number of embryologists. Number 2, there is potential to increase accuracy in picking the right embryo or blastocyst through AI. So the main kind of motivation to have AI in this field is to potentially increase the positive outcomes of IVF to be above 30%, which is the current percentage. And so there might even be factors that we don't know about yet in which our grading systems are not kind of sensitive to, where there are some lower grade embryos that are transferred, implant, and result in live birth, whereas highly graded ones don't. So maybe there's something that we're missing there that AI can help us with. And number 3 is accessibility. So right here I have a video. Maybe I'll just play it while I'm talking. So this basically just shows, is it gonna play? Anyways, if it doesn't play, it's basically just taking out a cell from the blastocyst mass in order to do a biopsy for genetic testing. And so this is kind of a risky procedure because you're manipulating the embryo in a way that is even more so than what you would normally manipulate it in IVF. And if we have specific AI to assess what we call like aneuploidy or euploidy, which is the normal chromosomal count, then we won't have to do this. And it might be more accessible to multiple populations, might be cheaper as well. And yeah, I forgot to mention that is the perfect embryo. So they kind of assess it through multiple facets of morphology like fragmentation, the bubbling. So yeah, you can kind of see it's very like quite symmetrical, not any visible like holes or anything. And here I'm just going to describe a study that I chose. And it's basically a meta-analysis about 20 studies that were quite rigorously put through this whole selection process. They ended up with 20. And they were trying to decipher the difference between AI predictions and embryologist predictions, so 1-to-1. And that would be in specific to, I think the 2 main ones were embryo morphology and clinical pregnancy outcomes. And I will discuss that more with some kind of tables and graphs from the study. So here we can see 15 of the 20 studies and kind of their varied uses of AI models, varied outputs, varied inputs as well. So the technologies that they used were between like image segmentation, time lapses, so those were AI models that were based on just image. There were clinical record, there's one right there. So that's a completely different form of machine learning in which you only use clinical records. And I think it was about like clinical information of the mother and the father, as well as embryo morphology without imagery. And then some of the studies also used both. So I was stating that there could be a potential limitation with the kind of generalization of the data because there is a high discrepancy between each study. But as long as I think we look at them separately, which is what the paper did, I think we can, have some pretty useful results. So here, this is just an example of the clinical characteristics and embryo morphology features that only the clinical information studies used. So that was about 6 of the 20 studies. And here are the AI prediction accuracies of every study. So basically, we can see, I don't know if you guys can read it, it's a little small. So the blue ones are embryo morphology prediction, the red is clinical pregnancy, yellow is the euploidy, which is the genetic testing, and green is live birth. So it's just one there. And we can basically see that it's kind of nuanced. There's not really a specific AI model that shows high accuracy, and there's also not really a what I would call a timeline related thing. So I kind of expected that there would be higher accuracy in more new AI models, whereas honestly that's not really present here. And then here we have just the 3 types that I was discussing earlier, and the AI versus embryologist accuracy. So as you can see, every single study had a higher accuracy in the AI model prediction versus the embryologist. I'm pretty sure the highest median accuracy was for both imaging and clinical information models, so those that incorporated both sets of information had the highest accuracy overall. And there was also another thing. So I'm pretty sure that the study found there would be an at least 4% increase in accuracy with AI models versus just embryologists. So now we're just going to quickly look at some ethics. So the first thing that I also kind of alluded to a little bit earlier is the idea that we might have a lack of legislation at the beginning of these specific techniques. So there's currently legislation on, for example, embryo discarding. So if we're doing research on embryos, we're not allowed to keep them alive after 2 weeks. And so that might also impact research and things in the future, which will also be connected to my next topic that I'll discuss. There's also things about custody at divorce, which is really interesting. So if you have an embryo that's 50% of both parents, who kind of decides at the point of divorce to, take on responsibility of that embryo? There was also a past issue with the number of embryos transferred. So kind of maybe 10, 15 years ago, they would transfer up to 6 or 7 embryos into a mother who was a bit considerably older, so maybe like late 30s, early 40s, and they assumed that they just wouldn't implant. Maybe one would implant, maybe not at all. So they decided to take the risk, right? And that resulted in a few examples of up to 6, babies within one pregnancy. So pretty crazy stuff, pretty, health anxiety music. And the second thing, what could arise from having this technology? So the idea that in the near future we could use IVF to pick specific embryos as per their, genetic traits, anything like that, their abilities, their intelligence, whatever it is, could potentially lead to either unwanted embryos or kind of like a bias in what we choose to conceive later on. And so the idea of having unwanted embryos can lead to our next approach, which is basically about artificial wombs. So the first thing that we have to look at is basically the wombs in media. So this is actually a fairly new movie that I watched recently, and it's kind of about like this post-apocalyptic world where robots are expected to take care of the human race. So they're kind of like choosing embryos, leading them up to gestation and birth within these artificial wombs. And the very funny and interesting thing that I noticed was that they kind of froze the embryos quite late. So they're actually at basically the fetal stage now. From what I can deduce, that's probably like a 10-week-old fetus. So as of right now, we don't have those kind of capacities yet, and they're not, thought to be well used in the near future yet. So that was just interesting. And then the idea of, is artificial womb kind of research or just the overall use of such a procedure, is that a fiction of the media, or is that actually a potential, likely outcome within the next 10, 20, 30 years? So we're going to look at this. It's kind of like a conceptual theory that this biotechnologist has created recently. And it's basically the idea that we're going to have, quite frankly, like embryo farms, and you're just going to have a bunch of these artificial wombs in line, and they're going to house babies. And so let's just go through these points. So the first one that this biotechnologist touted was that the technology is already there for the individual parts. And so he kind of thinks that our limitations are within kind of time, ethics, and just incorporating all of those components together. And again, the ethical guidelines, as I was saying before, was that we have to legally discard 2-week-old embryos. And so he thinks that if our ethical guidelines are loosened, that this technology could become a reality within 10 to 20 years. He also touted that there could be an elite package available to the highest payers, where before they actually decide to put the embryo in a chamber, they'll be able to pick like practically anything and everything within the capability and the morphology of that baby. So he even stated skin color, which is quite interesting, to say the least. And then, so the last point is very interesting as well. So he was kind of thinking about countries such as Japan, who have kind of this lower youth population right now and kind of a lack in just reproduction in general. He was saying, well, maybe those countries could potentially benefit from this technology of just like birthing babies. And I don't know how parenting would work in that case, but yeah, very interesting concept. Now on to the more scientific-based research. So this is the technology that we have right now. It's been present for probably a few years, and then I have the extend acronym definition right there. So this is considered to be partial ectogenesis. So they kind of take, for example, a severely premature sheep and they put it into this incubator, which is a little bit similar to what we use as well. But the kind of good thing about this technology is that they've taken like quite severely premature sheep, which are equivalent to, I think it was 22 to 24 weeks of human gestation. So at that point, there's quite a large risk on the baby. Like there's, even if we have all the technologies we have right now at the hospital neighboring us, that kind of age for babies is, you know, it's very, how would I say it? It's a very critical point. And so the idea that those babies can just easily survive with the technology we have now is quite limited. So this study showed that there might be, you know, a higher chance in the rate of those babies surviving with this basically environment. So it has all the nutrients, the blood circulation, everything that we don't have right now. They've kind of touted it as this new form of a womb. And that is pretty much my presentation, so questions, anybody?
Okay.
I got one question for you.
Yes.
So in this, like, I was just confused about that slide where it was like, I think it was like 2 slides before, where I think it was like this one, right?
Yes.
So like in this case, it's like, are they still using like sperm or like egg from
They
people?
are. It's just the fact that they have no use of basically like a uterus or a female
Gotcha.
womb at this point.
Okay.
Yeah.
That makes sense. Okay, cool, thank you.
Yep. Any other comments?
So, I sense a question about what's going to happen, but don't you also feel, having taken this course, that you can influence that to some extent, right? And like, what do you think about countries where individual young people just stay in their rooms all the time and never see other young people, right? Do you think what you should do is create a lot of babies like this without the young people really having to come out of their rooms or do anything much? Or do you think we should do things at the other end so that the young people want to actually come out of their rooms and interact and see other young people and develop social skills? And whatever you think, then, we could try to make that happen, right? So I really think that it's not the outcome of this course that we're trying to just predict as passive victims of the future what's going to happen. The idea of this course is we're going to advocate for stuff and shape the future in a positive way. So would you like to see a lot of the things that you've been depicting here actively used? And do a lot of the women that you know find the time spent in carrying and giving birth to a child to be not very positive parts of their life that they're not looking forward to? Or yeah, what are your thoughts about this?
Yeah, so about the first part of your question, like in regards to the actual implementation, I don't know. I think the side effect over centuries would be that young people would literally just stay in their rooms and have no social contact, potentially. I can see that as like a kind of long-term effect. I would say it is probably more beneficial to look at this as like a, what we currently have of like supporting our kind of severely prematurely born individuals instead of just like gestating them completely within an artificial atmosphere, because we also
Right.
don't know the implications of that. We know that the mother-child bond is very important. It could create a rift in society potentially, right? And I think it would be good to implement within those specific countries kind of this idea of maybe and it like something in relation to kind of their work ethic, where they don't have to feel like they need to work so much to sustain their lives. They can, socialize and all that. I think that would be beneficial.
Right. So isn't it true, though, that like in Japan, even if you eliminated all jobs and all work, as we think may happen in the future, that's not the thing keeping the young people in their rooms so much, because they're too young to have jobs at the time that they start that kind of life, right? That sometimes even within the family, they don't particularly enjoy seeing the other family members living in the same house, right? They just so yeah, it's not dependent upon whether humans remain employed or not. It's dependent upon whether young people, as a matter of course, have interaction frequently with other young people and want to do that, right? The only way it's going to happen is if like they want it, right? And if all the rewards, all the endorphin producing stuff doesn't come from other people, but from whatever goes on in their room, that's not going to happen. Yeah. So yeah, there's a lot to think about. But of course, one of the things, it's a very superficial thing, but probably still real, and that is that a lot of the regenerative medicine constructs we know of don't create quite the natural shape of things. Like the stem cell generated bladder is a little bit squared off and that sort of thing. It's not as round as the regular bladder. So it would be creating maybe a subset of the human race with like these squared off shapes and so on, from being maintained in something that's almost like the natural womb, but not quite. Yeah. So anyway, that's also something that could happen. Okay, thank you very much.